Next, we have our COVID-19 update with the Public Health Director Kathy McKay, and Jamie is here again today. Good morning.
Good morning, Mr. Chair and Commissioners. So I passed out the weekly COVID report. So you can see the number of cumulative cases, and they've increased since last week, both in Minnesota and in Clay County in general. Our cumulative deaths are 89 in Clay County, and they've increased in Minnesota a bit as well. Out of isolation is just those that have recovered and are out of isolation from their time where they had COVID. So those numbers, of course, are comparative to the active cases and the cumulative cases. Our active cases continue to rise, so our case investigators, contact tracers are still pretty busy with those active cases. We're seeing an increase in those, increase in the numbers, both in Clay County and, of course, across Minnesota as well. So the number of cases we're watching those as they go up a bit. The median age has been 33 for the last few weeks. Our number of hospital admissions and ICU admissions across the state of Minnesota, we're seeing quite an uptick. We're at a level as we were back in October. And so we're really seeing that level. That wasn't the highest peak, but we're seeing an increase. So the level we're at right now is where we were back in October. So it's a bit concerning that we're seeing that high level. The numbers across the river in our healthcare facilities, we're seeing less of an uptick, but a little bit of an uptick. I know their emergency rooms are where they're seeing a lot more activity. So they're busier at those healthcare facilities in Fargo. And then our 14-day case rate, again, consistent with the number of cases that are rising. It's at 40.45. Last week, it was at 29.94. So we're seeing that consistently along with the increase in our cases.
Kathy, what was our highest that we had at that?
14-day case rate?
186 something?
I don't want to go back there again, but.
Yeah, that was really high, and it was low for quite a long time, and so now we're just seeing that increase with the number of cases that we have. And the active cases by age, so it's still that 20 to 24 age range has been consistently the higher ones in the last few weeks. So we're seeing that group, and we've been really strategic about trying to get the students in higher ed vaccinated. It's, you know, we're against a timeline because, of course, their classes are done either the end of April or first part of May, but we've really been trying to encourage them. We were arranging to get a mobile unit out to those facilities, but now there's going to be we're going to have to halt that, and Jamie will talk about that in a little bit. The cumulative cases by age, again, are still the 20 to 24. So that seems to be the age range. We're seeing some in the K-12 schools as well, and as you can see with the news, there's various events that have created quite an increase in cases. There was a wrestling event in South Dakota, and there's a large number of cases from some schools that attended in Minnesota as well. So some of those events are still quite the spreaders. So, and again, I talked about the hospitalizations, so they're really watching that the increase in hospitalizations across Minnesota. So that's what we're seeing. You can see from the graph that there's been kind of a steady incline with those in hospitalization and those in ICU. And then I included the request for the weekly testing activities. So that was the vault testing. So you can see this is from the start of this year. So you can see the number of tests that were completed. And then the number of Minnesota residents versus the non-Minnesota residents, which is mostly the North Dakota ones that come over. And then the positivity rate. So as you look at the positivity rate, you know, it was quite quite low in January and February, and now we did see the highest, with the week of March 28th, the positivity rate for that testing site was 9.09%. This last week now it's 7.91%. So still a fair number of people. You see that 1342, the number of tests just the week of April 4th. So a fair number of people still going to the testing site, which is great for all the individuals that need to get a test done. It's the saliva testing. Results are coming back fairly quickly, sometimes within 24 hours. So it's a good means to get a test. Any questions on that?
Yes, sir, Commissioner Moore.
I had asked Kathy to bring forward this information. I know that there was discussions within the community wondering how long that site was going to continue to be in Moorhead. I think one item that is important to highlight is the amount of non-Minnesota residents that are continuing to use this site. And I think it speaks to the volume of we're really all in this together. North Dakota was helpful in Minnesota residents getting some testing early on, but it continues to be a spot where a lot of people are using it. I was honestly surprised to see that the numbers of usage were this high continuing, so I appreciate that. I know that there are some employers that are requiring employees to be tested. So I think that that's probably helpful for folks to know that that's an option if they need to.
Yes, exactly. And even those that travel, sometimes will want to get tested if they're unsure, depending on where they travel to.
Do our higher education facilities encourage their students to go there?
To the testing site, yes, absolutely. So, and even the K-12 schools, they're asking parents and their
Oh, I'm sorry,
students.
yeah.
I have another question in terms of the state sites that they have. Are they all still operational as they were a couple months ago, or have they shifted around where sites are?
Are you talking about the testing sites, state testing sites? Yes, as far as I know, they're still operational. We haven't heard any when they're going to demobilize, but they're still active and available. So they have not given us a date at all, even a projected date.
So the shortages in those tests that we had seen early on are not an issue right now?
Right, correct.
Thank you.
Thank you.
And may I add also, we still have the opportunity for home testing.
Right, thank you.
So that's another option for people as well. Minnesota Department of Health is encouraging families, if they travel or they're involved in activities, to test. And so as many opportunities as we can have for the public to.
Can you remind us how one gets the home test?
Well, you can order the home test and it's shipped to your home. And let's see. To order at-home COVID testing for Minnesota residents on the Minnesota Governor's site. There's a link there. There's also a link on the Minnesota Department of Health site. So at-home COVID testing for
Is
Minnesota.
it possible to put that on our?
Sure, it's
County
on the
Public
website
Health?
and it's on the Facebook page.
It is on our?
It is.
Okay, excellent.
Yep. Okay, so just looking at vaccine, we continue to provide vaccines. And last week, it was just almost 1,000, so we were at 999 doses that we administered last week, which was a little bit less than what we had hoped for. The challenge with getting those doses, as we talked about, exists, so we did open it up, and we did everything we could, contacting the media to encourage people to come in. We had staff that went to the site to register on site. We have a QR code that we're able to use if people want to come and use their phone and register. So we try to do everything we could to make it as easy for people as well. The challenge was that on the Fargo side and our healthcare systems, our pharmacies were all saying, we have plenty of vaccine, and so come. So, but this week, we are actually administering 1,000 second doses, so most of our focus is on second doses, but we also have some first doses. So we've separated those clinics just for ease, but we're mixing it up now, so if people want first doses, we can do that. The nice thing too is with a higher number of doses available to us, we have the ability to accommodate people that have not, they're coming back from down south, or, you know, they've received their vaccine, their first vaccine from one of the pilot sites, so giving them an opportunity. We had one of our pharmacies that said they were no longer doing Moderna, so they're referring them to public health. So that's nice that we have an opportunity for second doses.
Steve, are we giving our employees an opportunity to take time to run over and get one if there's available for them? Okay. Very good.
What are the hours of operation of that?
It depends, for us, depends on the day. So for this week, we are having a clinic today from 11 to 2. And then on Wednesday, we have 2 clinics from 9 to 1 and from 2 to 4. Thursday, 9 to 1, Friday, 9 to 1. And the times that we are scheduling are centered around utilizing the students in our universities, so that's why we're going with the times that we have. But we also dip into evenings and do what we can to accommodate people's schedules as well.
What do you mean by you go do evenings? Is that
If
by
we,
appointment,
like,
or-
to accommodate the school staff, the childcare centers, we've strategically scheduled clinics in the evenings to accommodate those needs. So that's
Does the
what I'm saying.
public, can the public go into those then, or just the schools?
At the time that we were doing them, yes, but now we're not, we don't have them this week, so it varies depending on who we're serving. So when we did schedule those clinics to accommodate the school staff, which was early on, we've, finished all of the school staff, we did evening clinics, and yes, the public was able to register for those clinics as well. But this week, we don't have any evening clinics.
How does the public come aware when there's an extra? Is that posted on the news, or?
Correct, and then the way we schedule is that they register with us, and when they register, they see the times that we have available.
Okay, very good, thank you.
But we haven't received any complaints at all about access. But again, I want to point out that there is a lot of access in the community for vaccine, a lot of opportunities, so. Okay, so getting back to the data, basically, the total number of individuals with at least 1 dose of vaccine in Clay County were at 36.8%, in Minnesota, 47.3%. Total number of people who've completed the series in Clay County, 26.1%. And statewide, 32.2. People aged 50 to 64 with at least 1 dose, 45.7, and 50.9 in Minnesota. 60 people with age 65 with at least 1 dose, 73.4% in Clay County and 84.1. And then cumulative 11,896 doses. So we are still lagging behind, but at one of our regional calls this week, we did have a discussion about the North Dakota pharmacies, which we know a lot of the Clay County residents are accessing for vaccine, and those data numbers are not going into that.
So Jamie, it's my understanding that herd immunity from the CDC standpoint is that 70% or over, is that correct?
Right.
So if everybody in Clay County was 65 or older, we'd have herd immunity.
Right,
Correct.
right.
Unfortunately, we're not all.
We have a lower 65.
Some of us are and some of us are not. But anyway, I guess, so of course, it took us from, maybe the first or second week in January
Yeah.
to this point to get to that percentage level for our 65 and older. Are we kind of tracking where we are with other age groups in terms of their percentages? And at some point in time, I'm concerned that we're only at 26.1% as a county as a whole. Now, I know we've just gotten started here, in the last 2 weeks where it opened up to everybody, right? But is there any way we can compare trends with those other age groups compared to? It sure be nice to see in 3 or 4 months' time where our entire county would be at that 70%, but it doesn't look like it's going that rapidly.
Right.
And what are your thoughts on that?
Well, we do have the ability to track that data in MIC for Clay County and for our region. But the other thing is just to kind of note that we really need to focus on education about vaccine, because there is still, the resistance of taking the vaccine, and that's what the providers who are trying to provide that vaccine have been faced with.
And that's exactly why I would like that data, because
Right.
it clearly shows that there needs to be more education. There's a lot of people concerned. They're concerned maybe about taking one type versus another, and then, of course, the news this morning that Johnson & Johnson is off the shelf for a little while. So it's, I think we have to do whatever we can to promote it too, and understanding that there's, some people just have different beliefs, but.
Right. Can I talk a little bit about Johnson & Johnson's?
Sure you can.
Just one comment before you do that,
Yeah.
though. So the state also, and we believe that this 26.1 is much higher, because we aren't capturing all of those, like Jamie mentioned, in North Dakota.
Okay,
So even those that went to the VA, those that go to the pharmacies, and it's slow to get the information also from the North Dakota Immunization Registry up to Minnesota Registry. So we do know that we're much higher than that 26.1%. It's just, we aren't able to get
But-
that number.
So before you go to, Jamie, to that, talking about Johnson & Johnson, so why is it good to reach herd immunity?
Well, just like the vaccines that prevent any disease, it's just so we have the majority of people, and that's why we really push the vaccine. So the majority of people, then you're protecting yourself and others. So you really
Doesn't that
want
really
to,
reduce the ability to spread?
reduce, reduce the spread is a big thing for, so as many people that can get vaccinated, it's really important, particularly when we talk about, they're working on the vaccine for emergency use authorization for the 12-year-old to 16-year-olds. And so, they aren't protected at all. They can't get the immunization yet, but, so you're right, it's to protect everyone in our community.
I'd like to see us get there. Jamie, you want to talk about Johnson & Johnson?
So Johnson & Johnson, as you heard, they're looking at some concerns with blood clots, and I believe it was in the news, is all we've heard. We haven't officially heard from Minnesota Department of Health yet today, but they are putting a hold on the Johnson & Johnson. In the last couple of weeks, we've worked very hard to access Johnson & Johnson vaccine, and we do have some for this week as well. The focus for that is on populations that struggle with housing, so they're more difficult to find. And so we had vaccine available. We do have some scheduled today, actually, that we're going to have to cancel. But also, Kathy has worked very hard with the state of Minnesota to try to access Johnson & Johnson vaccine for the students, the college students that have time for just one dose, and then will be leaving, so dispersing all over. And we haven't had the ability to access the vaccine for that population, except a very small amount that we had that was left last week. But it's unfortunate, because it's a great opportunity for us to vaccinate those individuals that are difficult to catch for their second dose, so.
Is that something that you're going to be able to save what you have, or it's not going to be ruined, is it?
We haven't gotten an official word yet from the State Health Department. They did ask that we would redistribute it if we didn't use all the 200 doses we had this week. So we'll have to see what their plans are for us.
I'm sure they won't want it redistributed. I'm sure they're going to want either for us to hold it or ask for it back.
But the storage is not a problem.
Storage for that, not at this point, is not a problem. That's correct. We did have a mobile unit that we secured also to get to the higher ed. So they all expressed that it would be so much easier if there could be a unit that did come to the campuses. So I was working with a group that was coming next week to the higher ed campuses, and they were going to use Johnson & Johnson, so.
When you talk about a mobile unit, Kathy, where does that come from? Where do you get that from?
The one I was working with was Essentia. Essentia Health had a mobile unit that we just had some contacts. I made the request and asked if they could come to our higher ed facilities.
So it's their bus or whatever it is
Correct.
that they.
Yes. They had the ability to have the nurses, the vaccine, and the mobile, whatever they whatever they had for a mobile unit to go out to the students, which I thought was a lot easier, and that was a request. So unfortunately, they were going to bring Johnson & Johnson to the students because they're soon done.
Okay.
So that was unfortunate.
Commissioner Mojos.
Thank you, Mr. Chair. I had a conversation with Representative Keeler this week. I know that we talked about the 72-hour piece, and she and I kind of worked through some of that. She did compliment Clay County. You are doing great things, and that's probably why the 72-hour hold makes sense for other counties, but doesn't necessarily make sense for Clay County. So she'll continue to work with it, work that through. I know early on I'd referenced, we do have shut-ins and elderly within Clay County, that transportation is an issue. And in seeing how the people with 65 and older with at least one dose only has risen like 1%, 1.5% for the past few weeks. Have we identified, is transportation an issue for those folks to get them to get a vaccination? One, and if it is, there are agencies like Lakes and Prairies that has a rural transport bus. Have we talked about having a nurse on a bus to reach shut-in communities or go to the senior centers within rural Clay County to have vaccination sites? I know it's a lot of legwork, but would that help us?
We actually have been working with them. They have coordinators that work with the senior population, and we've been working with them, and really, we're being told that people are able to access vaccine either through their local clinic, pharmacy, or public health. But that was our focus, is on transportation, so thank you for sharing that with us, and that's why we did reach out to them. We do have a list of people still that are homebound. It's not a large list. It's about 10, 15 people. And so those, we were hoping Johnson & Johnson would be a good source for them as well. So that was our plan. But we do have, we've spoken with all of the providers of home care in our community and with the social services and public health staff that work with the waivered services clients, the Land of the Dancing Sky, to identify those individuals. So that's encouraging that there's such a small number.
My follow-up to that is I think it's important that the public, in hearing these discussions, know that it's a person's choice. And it's your choice to have these. We are in no way giving it to folks that aren't consenting, and I think that's important. But we feel that it's safe, and I personally made the choice to have a vaccination, and I think that it's what we can do to help the betterment of our community.
I agree. And I too had the shots. Jamie, do you have any more for us on? Okay. Anything, any other questions? All right. Thank you.
Thank you.
Thank you.